I think my role this evening is going to be to inform you of what the state has undertaken with the opioid abuse situation in the Commonwealth. And there's been significant attention being paid to this issue. And I want to point out what some of those advances, if you will, have taken place. Approximately 10 years ago, the Commonwealth realized we had to look at reforming the policies involving substance abuse in the Commonwealth. Because we learned that between 2002 and 2007, we lost 78 soldiers to war. And in the same time period, 3,265 Massachusetts residents died of opiate-related overdoses. That's quite a statistic. In 2007 alone, there were over 100,000 admissions to DPH-funded substance abuse programs in Massachusetts. We realized we were in the midst of a serious and dangerous epidemic. In 2008, the legislature established the Massachusetts OxyContin and Heroin Commission to investigate and study the impact of this epidemic on our state and municipal governments. Our understanding of the problems surrounding addiction and prescription drug abuse has evolved. We know now addiction is a medical disorder. We have a duty to our citizens to help them help themselves, regardless of socioeconomic status, race, religion, or gender. The disease of addiction is devastating to all families. The legislature continued to work on providing comprehensive programs and treatment for those affected with this terrible disease. And in August of 2014, Governor Patrick signed into law a bill aimed at combating substance abuse. This new law, Chapter 258 of the Acts of 2014, becomes effective October 1st of this year. The new law requires, thank you, this is for your efforts as well. The applause is for you as well. The new law requires insurers to pay for up to 14 days of inpatient care for those in need of acute treatment. And it forbids insurers from requiring prior authorization. This has been a huge barrier to people wanting to get that treatment. This is just the beginning. 14 days is not enough. We'll continue to strive to make that an even more extended amount of time because that's what's necessary. For a bulletin regarding access to services of the new law, this is for you folks, and you can take this after the presentation. You can get some really valuable information at www.mass.gov/OCABF, the Office of Consumer Affairs and Business Regulation. We have acknowledged the harms associated with drug addiction over the past decade. More than 6,600 members of our communities have died because of opioids. In 2014 alone, there was a reported 1,256 overdose deaths in the state. This has to end. Governor's Opioid Working Group, which I might add, and I was remiss in mentioning that Senator Flanagan is at the same event up in Gardner this evening, and she offers her regrets for not being here, but she's up there as well, and we thank her for her efforts as a member of the Opioid Working Group. They traveled the Commonwealth, they listened, worked on a strategy for addressing substance abuse that deals with prevention, treatment, and enforcement. And in June, based upon the recommendations of this group, Governor Baker released an action plan to address the opioid epidemic in the Commonwealth. I want you to know your state and local officials are committed to providing you with support, understanding, and treatment of this disease. For a copy of the action plan, please go to www.mass.gov/Stop Addiction. Just today, Attorney General Healy struck a deal to offset the cost of Narcan. The pharmaceutical company that makes the opioid overdoses reversal drug naloxone will pay more than $300,000 into a state trust fund to make the medication more affordable to Bay State cities and towns. Tonight we gather as a caring community to shine a light on this terrible epidemic. Working together, we can remove the stigma surrounding substance abuse, because of so many of us know the pain and heartache that this disease inflicts on our families here in Fitchburg and across the Commonwealth. I want to thank everyone for coming this evening, and God bless the city of Fitchburg, and God bless the Commonwealth. And I want to introduce our chief,